Assalamu alaikum and welcome to another live session of Existential Poster Paper Competition, Episode 6. During this pandemic, Axis has given us medical students and aspiring doctors many amazing competitions, live sessions, and online classes, which help everyone to gain their skills. As promised, welcoming you all to Episode 6 of Poster Paper Competition with Team Universal. For today's live, I will be your mentor, Nahiyan Rydha Sumaiya from Delta Medical College, Dental Unit, session 2018 and 19. Hope you all will enjoy the live and sit with us during the session. And I would like to thank our Honorable President of Existential School, Dr. Farhad, for giving me the opportunity with honorable teachers for hosting this live. So without any further delay, let's get into our live session. As promised, Axis has given us amazing opportunities to meet the legendary professors of the country, outside and inside of the country. So it is my utmost pleasure and gratitude to introduce you all with our honorable judges for tonight. We have with us Dr. Mohini Daultani, gold medalist, consultant periodontologist, and implantologist, Apollo Hospital, Mumbai, Maharashtra, India. Professor Dr. Jalaluddin Mahmood Nipu, unit head, Kumudini Medical College and Hospital, Dental Unit, Tangai. And last but not the least, Dr. Anupam Podder sir, our very dear mentor and guide, Associate Professor, Head of the Department of Periodontology and Oral Pathology, Dhaka Dental College. Assalamu alaikum, teachers. I am welcoming you all with my warm heart. And let's get introduced to our tonight's presenters. Our presenters are Ayon Biswas from City Dental College, session 2017 and 18. Sadia Jannate Sathi, Dhaka National Medical College, 2016 and 17. And lastly, we have Tasnim Elahi Pinky, Chattogram International Medical College, 2016 and 17 session. Honorable judges, it would be very helpful and grateful to our presenters if you share some of your valuable advice for them. And then after your advice or after your speech, I will move on to the live session. And first, I would like to request to say something for us to Dr. Mohini Daultani, ma'am.
Okay, so yeah. Good evening, everyone. I want to really thank everyone for giving me the opportunity to stand here as a judge. I know how it is to stand on the opposite side because I have itself participated and given a lot of my clinical case presentation. And yes, for that, one of the judge were Dr. Anupam Podder, I still remember. So it's really, you have that butterflies in stomach. I really know that. So don't worry, students. It might be your first chance or it could be your second chance, but every experience count, and this is really going to help you in future. Every presentation adds up confidence to your skill, and this is really also going to help you in your CV also. So just be confident, be yourself, and don't worry. Just make sure that you give your best, and the rest is going to be decided by all of us. So just be yourself and give your best for the presentation. Best wishes to all the participants here.
Thank you, ma'am. Yeah. And then I would like to request to say something for our presenters to Dr. Anupam Podder, sir.
Thank you. Today's moderator, Nahiyan Rydha, a student of Delta Medical College, Dental Unit, best 2018 and 19, for your outstanding moderation.
Thank
Very
you,
good
sir.
evening. Honorable judges, Professor Dr. Jalaluddin Mahmood, Nipu sir, Unit Head, Kumudini Medical College Dental Unit, and ex-head Department of Periodontology and Oral Pathology, Dhaka Dental College. And Dr. Mohini Daultani, he obtained gold medal in MDS course I am very much proud to her. She is a consultant of periodontist and implantologist, Apollo Hospital, Navi Mumbai, India. Axis Dental School and their team are very grateful to them because they are very busy practitioners, but they are with us due to our academic interest for sharing knowledge to our beloved students.
Yeah, thank you.
Today's participant comes from Ayon Biswas from City Dental College, Sadia Sathi from Dhaka National Medical College Dental Unit, and Tasnim Elahi Pinky, Chattogram International Medical College, Chattogram International Dental College. Thanks all of you for your active participation. I have some advice to our participants. Today's group name Universal. Universal. The universal name comes from the non-surgical procedure periodontal instrument, that is universal curetage. This comes from universal, and another curetage, this is the Gracis curetage. There is another team, the name of Gracis curetage. The universal curetage we usually done root planning procedure, and so now I'm going to evaluation to our evaluation criteria to our participants. That is, we evaluate you by your topic discussion and slide preparation and explanation with diagram, inclusion of evidence-based data study, and understanding of the subject, response to question and answer session, and reference uses, dressing sense, and presentation skills, and maintenance of time. The time is very sensitive. Thus, will mark you, each judge will mark you 100. Every judge, we will make a percentage by aggregate of marks of 3 judges, and also include 10% mark from social media. Love, care, and like. Those are previously declared in social media. Thank you, all participants and all judges and all teams of Axis Dental School. Thank you.
Thank you, sir. I would like to request Dr. Jalal Uddin Mahmood Nipu, sir, to give some suggestions to our participants.
Please unmute, sir. Sir, please unmute.
Thank you to invite me as a judge of these webinars, and I also say good evenings and say assalamu alaikum to all the judges and the presenters of this session. Today's topic is periodontal instruments and instrumentations. It's a very important topic, and I think that all the three presenters are well prepared for these presentations. And from me to the presenters, don't be afraid or panic, and don't be nervous. We are friendly. That's all. Thank you.
Thank you, sir, for your valuable suggestion. I would like to move on directly to the competition. And before the competition, I would like to read out the rules for the presenters of tonight. Each participant will get 10 minutes for the presentation. After 8 minutes, I will be allowing you. And after 2 minutes, they have to end their presentation. After the presentation, the judges will discuss about the presentation. So without any further delay, I would like to get into the presentation. And for tonight's presentation, I would like to remind everyone the topic of tonight's poster paper competition is periodontal instruments. And for today's poster paper competition, first I would like to present Ayon Biswas from City Dental College. Ayon Biswas, I would like to hand over the presentation and share the screen.
Thank you. Assalamu alaikum, namaskar, and a very good evening to my respected judges and my fellow mates and others who are watching me through live right now. Firstly, I'd like to introduce myself. My name is Ayon Biswas. Currently, I'm studying at City Dental College and Hospital, and my session is 2017 and 2020. Today, I'm going to present a very interesting topic, if that is periodontal instrument. So, further any delay, let's move on to my rest of the slides. That is my contents. My contents includes introduction, classification of periodontal instruments, and diagnostics. We are on to my next slides. So, what are periodontal instruments? Periodontal instruments are the instruments which are designed for specific purposes, such as calculus removal, biofilm removal, and root planning. Moving on to my next slide. There are three pictures showing what periodontal instruments do. On the first picture, we can see pocket measurement. On the second picture, we can see plug removal. And on the third picture, we can see calculus removal through scaling and planning. Typical periodontal instruments has two parts. First one, the working end, which is also known as blade. Second one, the shank. And lastly, the handle. Moving on to my next slide. My next topic is classification of periodontal instruments. So periodontal instruments are classified according to purpose as follows. Number one, periodontal probes. Number two, explorer. Number three, scaling, root planning, and field test instruments. It includes A, for supragingival scaling. Under this, we have sickle scaler. B, for subgingival scaling. Under this, we have core, chisel, and file scaler, and curettes. Number C, sonic and ultrasonic instruments. And number D is implant instruments. Number 4 is periodontal endoscope. Number 5 is cleaning and polishing instrument. It includes rubber caps, brushes, dental tapes, and hair powder abrasive system. Number 6 is surgical instrument. It includes excisional and incisional instrument, surgical curettes and sickles, periosteal elevators, surgical scissors, hose, files, scissors, and nipples. Moving on to my next slide. My next topic is diagnostic instruments. So we can see here three diagnostic instruments. First one is periodontal probe, second one is the explorer, and the last one is periodontal endoscope. Moving on to my next slide. So what are periodontal probes? Periodontal probes are used to measure the depth of the pocket and to determine their configuration. The typical probe is tapered, rod-like instrument calibrated in millimeter with a blunt, rounded tip. Here we can see a picture of pocket measurement. Moving on to my next slide. There is different type of periodontal probes. First one is Mercury's color-coded probe. Second one is University of North Carolina 15 probe. Third one is University of Michigan O probe. Fourth one is Michigan O probe. And the final one is World Health Organization probe. Moving on to my next slide. Here we can can I hear?
I think there's some network issue with him.
Okay. The word health underscore the minimum and the body health is assigned are angled. Sorry, ma'am. Moving to my next slide, there is another kind of probe, this curved to neighbors probe. The percussion area can best be evaluated with the curved blunt neighbors probe. Moving on to my next slide. My next topic is agreeable deposit to check the smoothness of root surface after root planing. Moving on to my next slide. There is a different type of explorer, type A, type B, type C, type D, and type E. Moving on to my next slide. There is a picture of calculus detection. Here you can see insertion of two types of explorer and a periodontal probe. A, the limitation of the pigtail explorer in a deep pocket. B, insertion of the number 3 explorer. C, limitation of the number 3 explorer. And D, lastly, insertion of the periodontal probe. Moving to my next topic, the dental endoscope. A dental endoscope has been introduced for use subgingivially in the diagnosis and the treatment of the periodontal disease. Endoscopes are used for deep visualization into the subgingival pockets and percussion, thereby allowing the detection of deposits. The periscopy system can also be used to evaluate subgingival areas for caries, defective restoration, root fracture, and resorption. Moving on to my next slide, there is a true picture of the periscopy. First picture is periscopy system of dental endoscope, and the second picture is viewing periodontal explorer for the system periscopy system. Moving on to my next slide, there's a picture of periscopic instrumentation permit give subgingival visualization in the pocket and percussion. Here are my references which are used to take the notes from. I'd like to take a moment to thank everyone who listened to my presentation. Thank you, my honorable judges, for sparing us your valuable time. Thanks to Excel Dental School for creating and managing an incredible program. And lastly, I look to thank all of my teachers who helped me out through this and inspiring me to participate in this program. Thank you all.
Thank you, Ayon Biswas, for your beautiful presentation. So I would like to say something. I would like to say something our judges to about Ayon Biswas' presentation.
Yeah, Rydha, please continue your session. Then finally we discuss with CV presenter.
Then I would like to invite our second presenter, Sadia Jannate Sathi from Dhaka National Medical College, session 2016 and 17. Sadia Jannate Sathi, you can start your presentation.
Thank you. Hello. Hello.
You are audible and I have started the stopwatch.
Thank you. I'm Sadia Jannate Sathi from Dhaka National Medical College. My session is 2016 and 17. Here presented to non-surgical therapeutic periodontal instruments. Here is my content. My contents are introduction, parts, classification, design with features, varieties, use with function, false friend, indication, contraindication, and conclusion. Now we have known about some introduction in periodontal procedure. Maintenance of dental health of the periodontium, such as gingiva, periodontal ligament, and alveolar bone, is is vital for an individual's overall dental health. Disease of periodontal is referred to as periodontal disease and is a common dental problem. The dental team uses specialized instruments to maintain good periodontal health or to reverse the effects of periodontal disease. Now we have to know about periodontal instruments classification. They are divided into three types. There's a diagnostic, non-surgical therapeutic instruments, and surgical therapeutic instruments. Non-surgical therapeutic instruments are scaling, root planning, cartridge instruments, and cleansing and polishing instruments. Now we have to know parts of a typical periodontal instruments. Each typical periodontal instruments has three parts: the working end, the shank, and the handle. Now we have to know about scaling and cartridge instruments. Scalars are divided into two parts. They are supragingival scalars and subgingival scalars. Supragingival scalars are sickle scalars, Morse scalars, surface scalar, Kumudini scalar, and subgingival scalars are hoe scalars, scissor scalars, and periodontal file. Now we have to know about sickle scalar. Is designed in triangular in cross section with a flat face. The lateral surfaces meet the face to form two cutting edges and a pointed tip. The face is perpendicular to the lower shank. The shank is divided into two parts: anterior sickles and posterior sickles are simple designs in anterior sickles and with straight shank, and posterior sickles are complete design with angle shank. The shape of the instruments makes the tip strong so that it will not break off during use. Now we have known about its function and features, varieties, and false friends. Functions is to remove supragingival calculus and plaque, and varieties are available in anterior and posterior instruments with a variety of working ends. Can be single-ended or double-ended. False friends are sickle, contra-angle prof, aggressive curers. Now here is some sickle scalars picture with their working end. Now we have to know why the sickle scalar is used primarily to remove supragingival calculus. Because the design of this instrument is it is difficult to insert a large sickle blade under the gingiva without damaging the surrounding gingival tissue. Now we have to know Morse scalar. It is small miniature. It has a small miniature blade and used in the mandibular anterior area. Surface scalar is used for removal of surface stains. Kumudini scalars are used for removal of heavy tenacious calculus and can also be used for removal of granulation tissues. Now we have to know about hoe scalar. Hoe scalars are using for scaling of the edges of rings of calculus. Now we have to know about scissor scalars and files. Scissor scalars are designed for the proximal surfaces of the teeth too closely spaced to permit the use of the other scalars. It is usually used in the anterior part of the mouth. And files have a series of blades on a base, and their primary function is to fracture or crush large deposits, the tenacious calculus, or varnish sheets of the calculus. Now we have to know about curers. Curers are divided into three parts. There are universal curers, area-specific curers, and different larger and mini-larger curers. Universal curers are Branhart curers and Columbia curers, and area-specific curers are Gracie curers and extended shank curers. Now we have to know about universal curers. Each working end has a cutting edge on the both sides. The curers is finer than the sickle scalars and does not have any sharp points or corners other than the cutting edge of the blades. Then, therefore, these curers can be adapted and provide good access to deep pockets with a minimal soft tissue trauma. Now we have to know about its function and features. It is used to remove stains, supragingival and subgingival calculus, and plaque, and used in root planning. Its varieties can be single-ended or double-ended. Its false friends is scalars. Now we have to know about Gracie curators. Function and features are designed to adapt the specific areas in the mouth. An apparator will need a full set of instruments to work in all areas of the mouth. Here is some pictures of Gracie curators with their working end and their measurements. Now we have to know about the difference between Gracie and universal curers. Gracie and universal curers are differentiated by set of many curers Gracicures are set of manicures designed for specific areas and surface. One cutting edge used, work is done with other edge only. Curved in two planes, blade curves up and to the side. Offset blade, face to blade, be built at 60 degrees to the shank. On the other hand, universal cures are one cures designed for all areas and surface. Both cutting edges used. Working is done with both outer and inner edges. Curved is one plane, blades curves up and not to the side. Not offset, face of the blade be built at 90 degrees of the shank. Now we have to know ultrasonic and sonic instruments. They may be used for removing plaque, scaling, curating, and remove stain. Cleansing and polishing instruments are rubber caps, blister brush, dental taps, and nail polishing powder. Here they consist of rubber of shell with or without configuration in a hollow interiors. They are used for in the handpiece with specific angles. On the other hand, blister brushes are available in wheel and cup shapes, used in handpiece with a polishing paste. Dental tap used with a polishing paste for polishing proximal surfaces. Air polishing powder are a specially designed handpiece that delivers air powder slurry of warm water and sodium bicarbonate. This instrument is called Prof, effective for removal extensive stains and soft deposits. Indication and contraindication of non-surgical therapeutic instruments are indication are removal of all tooth deposits, supragingival calculus, subgingival calculus, plaque and stains, and contraindications are a pacemaker, since ultramagnetic sound waves from the ultrasonic unit may interfere with the ultrasonic function of the pacemaker. Contagious diseases such as hepatitis, HIV infection, tuberculosis, throat and respiratory infections, since the microorganisms are spread in the aerosol from the instruments. Uncontrolled diabetes, desquamative gingivitis, deep pus producing pockets, undergoing prolonged antibiotics, chronic nutritional deficiencies.
You have already finished your 8 minutes.
Conclusion is non-surgical therapeutic instrumentation remain a key treatment approach for management of periodontal disease, while the rationally underpinning non-surgical treatment and approaches to therapy has not changed recent years. Clinicians should be aware of the variety of the modifications made to improve the comfort and efficiency of the operator. Thank you so much. Thank you for hearing me.
Yes.
Thank you, Sadia Jannate Satyapu. Without any further delay, I would like to invite and provide the presentation slide to our very last and next presenter, Tasnim Elahi Pinky from Chattogram International Medical College, session 2016 and 17. Tasnim Elahi Pinky Apu, if you are audible, then you can share and start your slide.
Yes, Nahiyan, can you hear me?
Yeah, I can hear you, and I am starting my stopwatch.
Okay. Assalamu alaikum. This is Tasnim Elahi Pinky. Firstly, Assalamu alaikum, and I would like to thank the honorable judges and Existential School for giving me such a great opportunity. I'm from Chattogram International Dental College, session 2016 and 2017. This is our Chattogram, in which our Chattogram International Dental College is situated. It was established back in 2003. This is facilitated not only confined in our labs and classrooms, but it is also well facilitated to develop our moral values and to make ourselves as skilled dentists. My presentable topic is periodontal instruments, and the contents that were given to me are therapeutic surgical instruments and conclusion. In therapeutic surgical instruments, there are excisional and incisional instruments, surgical curettes and sickles, periosteal elevators, surgical chisels, surgical files, scissors, hemostats, and tissue forceps. Now we will see some series of periodontal surgical instruments. These are some typical surgical instruments. Now we should know in which surgeries we use these surgical instruments. The instruments that are used in following periodontal surgeries: gingivectomy, gingival curettage, periodontal flap surgery, the mucogingival aesthetic surgery, guided tissue regeneration, osseous surgery, resective and regenerative. Now, excisional and incisional instruments. Let me take the laser pointer. This is the Kirkland knife and Orban knife I have shown. The blade has the cutting edge and it is kidney shaped, and the lower one is Orban's knife. It is a spear shaped and the blades both ends has cutting edge. There is some surgical blades, and this is BP handle. This is contraangle BP handle. When the surgical blades are inserted in this BP handle, we call it as scalpel. Now we will know more about these instruments. Periodontal knives or gingivectomy knives. The Kirkland knife is representative of the knives that are typically used for gingivectomy. The entire periphery of these kidney-shaped knives is the cutting edge. Here we can see the Kirkland knife again. This is used for gingivectomy. Interdental knives. The Orban knife is used for interdental areas. These spear-shaped knives have cutting edges on both sides of the blade. We can see cutting edges on both sides of the blade. Surgical blades. The most common blades are 12D, 15 and 15C. The 12D blade is beak-shaped with cutting edges on both sides, allowed to engage narrow and restricted areas with both pushing and pulling cutting motion. The 12D blade, we can see the beak-shaped, cutting edges on both sides. Then the 15 number blade. This is a 15 number blade. It's used for thinning flaps and general purpose. The 15C blade is useful for making initial scalloped type incision. Surgical curates and sickles. Larger and heavier curates and sickles that are used for removal of granulation tissue, fibrous interdental tissues, and tenacious subgingival deposits. This is pre-church surgical curate. The pre-church curate and the Kirkland surgical instruments are heavy curates, whereas the ball scaler number B2, B3 is a heavy sickle. This ball scaler is a heavy sickle. Now, periosteal elevator, another common instrument for periodontal surgery. These are needed to reflect and move the flap after incision. The Uddin and the pre-church elevators are well-designed periosteal elevators. This is periosteal elevators. We can see there is both ends. One is sharp end, other one is broader end. The sharp end is used to release the dental papilla, whereas the broader end is used to reflect the mucoperiosteal flap. Surgical chisels. The back action chisel is used with a pull motion. This is the back action chisel. The name of back action chisel is Rodson chisel. The straight chisel, Oxenbane number 1 and 2, is used with push action. The Oxenbane chisel is a useful chisel with a semicircular interdentation both sides of the shank that allows the instrument that engages around the tooth. This is Oxenbane chisel. Tissue forceps, used to hold the flap during suturing, also used to position and displace the flap after the flap has been reflected. This is DeBakey tissue forceps. It is widely used in dentistry. Scissors and nippers. These are used to remove dabs of tissue during gingivectomy, to trim the margins of flaps, to enlarge incisions in periodontal abscesses, and to remove muscle attachments in mucogingival surgery. The Goldman Fox number 16 scissors I have shown here. Here we can see the blades are curved and beveled with serration. Then the needle holders. These are used to suture the flap at a desired position after the surgery completed. This is the needle holder we can see. There is another needle holder. In addition to the regular types of needle holder, the Castrovejo needle holder is used for delicate, precise techniques that require the quick and easy grasp and release of the suture. This is Castrovejo scissors. Conclusion. The aim of the periodontal therapy is to remove all the local factors responsible for disease progression and to make periodontal tissue architecture conducive for self-oral hygiene maintenance. These goals are achieved by non-surgical and surgical periodontal therapy. A thorough knowledge of instruments, their method of clinical application is mandatory before their clinical usage. Now I want to say that dental care is our game and excellence is our goal. The references are Newman and Carenz's Clinical Periodontology, 3rd South Asia edition, Carenz's Periodontology, 11th edition, Essentials of Clinical Periodontology and Periodontics by Shantri Priya Reddy, Perio Basics, the textbook of Periodontics and Implantology, 2nd edition. I want to conclude my presentation with a beautiful quote, intelligence plus character, that is the true goal of education. Thank you so much. Now I would like to ask the moderator to take over. Thank you.
Tasnim.
Thank you to our presenters for their beautiful presentation. And without any further delay, I would like to inform our judges the time of the time taken by our presenters for each of their presentation. First, I would like to start with Ayon Biswas. Biswas took 8 minutes 28 seconds for her presentation, and then Tasnim Pinky Apu took 7 minutes 36 seconds for her presentation. Thank you, dear presenters, for your beautiful presentation and all of your effort. Then, without any further delay, I would like to move to our judges for their valuable opinions and the judgment of the presenters. I would like to start with Dr. Anupam Podder, sir.
Thank you, Nahiyan Rydha, for your wonderful moderation of today's session.
Thank you.
I have three presenters. Within I will ask question for three presenters in same time. Who give answer, please raise hand and give answer, please. Do you know the instrument, the periodontal Kaplan pocket marker? Do you know the any pocket marker name? Mohini?
Yes, sir.
Yeah, name of the Kaplan pocket marker. This is right. Another name, pocket marker.
Kaplan's pocket marker, sir. That is called as Kaplan's pocket marker.
Kaplan.
Yeah, sir. It's that.
Hello, Balaji. How are you?
Hi. Crane Kaplan pocket marker.
Crane Kaplan pocket marker. Yes.
Crane Krane. Crane. Kaplan. Crane Kaplan.
Do you know the Crane Kaplan pocket marker? Nobody discuss about this pocket marker here. Okay. Please give me the UNC 15. The periodontal probe. Please discuss about the UNC 15 periodontal probe. UNC 15 periodontal probe. Nobody?
One of the student had mentioned it as University of North Carolina. Uska short form UNC 15 probe hai. So right now you people could at least talk now.
UNC, University of North Carolina, UNC 15.
Yeah.
Do you know about the marking of this UNC 15 pocket marker? Marking criteria? Nobody. Then my last question. What are the
Sir,
different? Yes.
UNC 15 15 color coded prof হচ্ছে গিয়ে স্যার mark in 3 millimeter sections calibration আর markings হচ্ছে গিয়ে স্যার 3, 6, 9, 12 millimeter.
Dr. Mohini and Dr. Balaji Manohar, this answer is clarified by you, both of you, in next time, in ending the session. Okay.
Yeah.
Okay. And okay, and another question: what are the difference between basic curettage and universal curettage? Basic and universal curate.
The universal curate is about 90-degree angle with the shank, but basic curator is 60 to 70-degree angle with the shank. And then basic curator is offset and universal curator is not. Then basic curator cutting edge, one cutting edge is used, and in case of universal curator there is 2 cutting edges used. Then basic curator, there is a set of basic curator that is used in different teeth, used for different teeth, different places, and then universal curator used for all the tooth.
Sir, basic curators set of many curators designs for specific areas and surface. Then universal curators হচ্ছে গিয়ে one curator designs for all areas and surface. Then sir, basic curator হচ্ছে one cutting is used in work and is done with the outer is only. Work is done with the outer is only. Or both cutting is used. Work is done in both outer and inner is in universal curators. আর স্যার গ্রেসি কার্টেজ হচ্ছে অফসেট ব্লেড হচ্ছে বিবিল্ড করে at 60 degrees of the shank. আর ইউনিভার্সাল কিউরেটসের স্যার নো অফসেট থাকে and এটা face of the blade বিবিল্ড at 90 degrees to the shank.
Well, thank you. Now, Rydha, you can go to our next judges.
Thank you, Dr. Anupam Podder, sir, for your valuable judgment. Then I would like to move to our international judge, Dr. Mohini Daultani, ma'am. Can you please share your valuable judgment for our presenters?
Yes,
Please.
first of all the 3 presenters were very nice. It was very nice to interact with you all. My first question is, how much is the force that you apply to do the probing? Any of you can answer from 3.
6 force.
What? Hello, how much? I'm not able to hear you.
4 force.
I'm asking you in grams.
4
here.
force, ma'am.
4.
Ma'am, can I answer?
Yeah, everyone.
0.75 m. 0.75
N.
G ma'am.
What is the full form of N that you're quoting?
0.20 grams. 0.20 grams is
First of all,
Newton is Newton 0.75 Newton. I'm using as n.
okay. So that is 25 grams around, 20 to 20.
20.20 grams.
Okay, so that was the thing. One more question. Right, in today's era where we have so much of COVID going on, So just in case if you get a patient who has just had a COVID recently, he came to your clinic or he came to your department. So what would you advise him? Like you will be going with hand scaling instruments or ultrasonic instrument, like scaling. With what will you prefer?
Miss, I prefer ultrasonic instruments because it is more safe for me and for patient too. From my history, I can know about about his or her. If he COVID positive, I cannot handle him or her. If he negative, then I work on her and I use ultrasonic instruments.
My question is, patient was already COVID positive. So now when he comes to you, he is not COVID positive. He comes to your department for routine checkup, and now he wants to get his scaling done.
I have to take extra precaution for him because as he has COVID patient and it passes through fecal oral, and we have to use double masks, double gloves, and sterilize the instruments before and after scaling.
Okay, universal precautions will be taking. My question is, just give me one answer. You will do hand scaling or you will do universal scaling, and I want the answers to be given by all three students compulsorily. Ayon, give me your answer. Hand scaling you will do or you will do ultrasonic? That's it.
I'll do hand scaling.
Ma'am, ultrasonic.
Okay, you will do hand scaling.
Ultrasonic.
Okay.
No, Miss, I do
I'll use
ultrasonic.
ultrasonic.
And Sadia will do all. Okay. Ayon, why will you do hand scaling?
Ma'am, because after the hand scaling, we can sterilize this properly.
What?
After hand scaling, we can sterilize the hand scaler properly because he was COVID patient.
Okay, so that is your answer. Okay, we will have this discussion once even other judges get it done. I think Dr. Anupam Podder knows the answer. So we will have the discussion once the session is getting over. Yeah, Dr. Nahiya, moderator can take over to other judge, even they can ask the question and then be fine. We'll have a final discussion at the end.
Yes.
Okay.
Thank you, ma'am, for your valuable judgment. Then I would like to move on to Professor Dr. Jalaluddin Mahmood, sir, for your valuable judgment. So, sir, please can you proceed as new judgment?
Okay, thank you all the three presenters present their papers very nicely and confidently. My questions first to Ayon Biswas. You have shown the periodontal probe. Who probe? WHO probe. So at the end of the probe, there is a ball end. What's the size of this ball? Can you say? Ball ended probe. What is the size of the probe? You have also mentioned the size.
Which probe, sir? Which probe?
Who probe? WHO, World Health Organization.
Sir, can you please repeat the question, sir, please?
What's the size of the ball end of this probe? Ball, size of the ball. At the tip of the probe, there is a ball. And what's the importance of this ball?
The size of the ball is 0.5 millimeter.
And what's the importance?
Sir? 0.5 millimeters is the size of the ball, and the importance is
Tasnim, can you tell the importance of this ball? Tasnim Elahi?
Yes, sir. Sir, the ball, it's important. Sir, can you tell me the question again? Ask me the question again.
No. Who probe? At the end, there is a ball. What is the importance of this ball? Why the ball?
By the ball, it is used for because it will so that it do not harms or irritate the gum tissue, or it can be used fluently because of the ball. Otherwise, it can if it is sharp, then it can harm or irritate the surrounded tissues.
Is it the surrounding tissues or some special points, some things? Okay, Sadia, Jannat, can you tell?
Yes, sir.
Did you listen what I said?
Yes, sir.
Can you answer?
Sir, the props have a ball tip of 0.5 millimeter. Its importance, which is it permits dentists to identify the sites with a history of periodontal disease. Then or those at the risk of the periodontal breakdown.
Okay, the importance of the ball is that if probe is very sharp, the other probes, it can pinch the apical tissues, so it can injure that area. That's why the ball ended and very small. And my next question is that in subgingival scaling, which instrument we use? Sadia, Jannat, you say. Subgingival scaling, which instrument we use?
Yes, sir. Can you question me again, please?
Subgingival. There is a supragingival and subgingival. So subgingival scaling, which instruments we use?
So subgingival scaling এর ক্ষেত্রে স্যার আমি সিকেল স্কেলার, মর্স স্কেলার, সারফেস স্কেলার এন্ড কিউম্যান স্কেলার ইউজ করব। এটা হচ্ছে সুপ্রাজিঞ্জিভালের ক্ষেত্রে। এন্ড সাবজিঞ্জিভালের ক্ষেত্রে স্যার হচ্ছে হোই স্কেলার, সিজাল স্কেলার, পেরিডন্টাল ফাইল এন্ড ইমপ্লান্ট স্কেলার আমরা ইউজ করতে পারি।
Scalar, you will use the scalar. So the next is Tasnim. Which instrument you will use?
I'll use the curate for subgingival scaling.
Curates. Okay. What is the difference between curates and the scalar?
Sir, scalar will only remove the calculus, but the curate will remove the calculus and the gingival lining also. This is gingival lining also.
Actually, the scalars, sickle scalars, not scalars, is strong and wide. And though there is some special variations, but usually strong and wide, you cannot put inside the subgingival tissues. It will injure the subgingival tissues. That's why we use the curates, the thin and very fine. So we can use the subgingival scalings, the curates. But my last question is that one of you said that the use of chisels and hoe, what's the action of motion? What's the action? Which direction you will move? This hoe or the chisels and chisels? My last question. Sadia, you can say.
Sir, the hoe scalar হচ্ছে কি স্যার used in so the blade is inserted to the base of the periodontal pocket so that it makes 2-point contact with the tooth. This stabilizes the instrument and prevents nicking of the root.
I want to know that you said is a pull or push motion. Which motion? Pull or push?
Sir, this is sir, please
Tasnim, can you say?
It's full, sir, it's full stroke, full motion.
Full motion. Ayon Biswas,
Sir, it is full motion, sir.
full motion. Chisel.
Yes, sir.
Usually scalar we use, that is, we use the full motion, but the hoe, chisels, and the
There's
files,
trapping.
do you use it the full motion or the push? These instruments
Trapping.
usually used for remove the calculus or just smoothing the surface.
Sir, it's tenacious subgingival calculus we remove by the
Smoothening the
hoe,
surface.
chisel and files.
Usually we do not use these instruments for removing the calculus. Usually
Smoothing the surface.
smoothing the surface, and we should be very careful with using these instruments because it may, if you are not careful, it may remove some dentin also, very soft structures. So that's all. Thank you.
Thank you, sir.
Thank you, sir.
Rydha, dear
Thank
Rydha,
you.
today's moderator.
Yeah.
Now you we move to the discussion part. Dr. Mohini and Dr. Balaji Manohar will discuss about the today's question and answer session, and they give the proper answer of these today's question. So you asked the Dr. Mohini and Dr. Balaji Manohar sir, who is a nice guy, who are always with us, and he tried to accompany with us and try to develop our periodontology in Bangladesh. We are very much proud of him, and I am very thankful to you. Thankful to him. You please, you ask them for discussion.
Thank you, Anupam sir, and thank you to the presenters also. And I would like to ask Dr. Mohini sir, Dr. Mohini sir, about their opinions about this topic's discussion. If they want to discuss something with us about the topic, periodontal instrument.
Yeah, first of all, I would if Dr. Balaji Manohar could even start, that is okay. Like, sir, you're on mute mode. Mute.
Yeah, I said you are the judge today. You should do the honors
No,
first.
sir. You are
Carry on.
It's your
Carry on.
Okay. I had asked actually about if you have a COVID patient, if all 3 students are active right now to hear if you will be taking up hand instrumentation or ultrasonic instrumentation. Ultrasonic, one of the contraindication, as you had said, like it's a communicable disease. We can't say like COVID is a communicable disease, but even if patient was a COVID positive 1 week back, we are at least supposed to wait for about minimum of 2 to 3 months to do ultrasonic scaling. So if patient comes to you, what the literature says is we have to do hand scaling instruments because the viruses remains in latent form for at least 2 to 3 months. So just for a safer precaution, but obviously we all are going to take universal. COVID has taught us that, precaution is very, very essential. But if you have a COVID case coming up in your department and your case history you come to know, so you have to first do hand scaling instruments. Only after a safety period of 3 months, you're supposed to do ultrasonic scaling. So that was my answer. And that is very important in today's era that we should know about it. Yeah. I hope Dr. Anupam Podder made justice. Yeah.
Thank you, ma'am.
Thank you, Dr. Mohini.
Thank you, ma'am.
I would like to ask Dr. Jalaluddin Mahmood Nipu sir, if you want to share something with us about today's presentation and with our presenters.
So, okay. So I congratulate all the presenters because they are the fourth year students, I think, and then third phase students. And even though they are not acquainted with the practice, but they work hard and go ahead and have gone through the books and see the picture photographs on the books of the instruments. They don't know even the in practical these instruments, all these instruments. A few maybe they know, but they work hard, and by this way I think they will learn and they will be experienced. I say keep going on this practice, and it's a very interesting, courageous, and I think you will learn more in this way. And and I also thanks to the international judges and advisor, Mr. Dr. Balaji Manhars. These are friends, yes, and Mohini, Dr. Mohini, the present in this as a judges. So, and also the moderator, there's a Nahiyan reward, smiling face all the time. So I also thank him, and lastly there's Anupam Podder, and he just supervised all these programs, and that's all. Thank you.
Thank you, sir.
Yeah, I would like to just say a few words. I agree with Dr. Mohini when she said that we have to use the hand scalers. When COVID had begun, all of us came to know that we should not use ultrasonic scalers because it produces aerosol. So with the aerosol, the virus may get into the atmosphere, and it might go and sit on, I mean, it might get affected on some surfaces in the clinic or some other instrument. So it was being avoided. It was seen that the virus in the air may travel up to, the aerosol virus may travel up to about 6 meters. It was seen to have traveled, and studies had shown that it has affected surfaces up to 6 meters. But slowly that criteria has come down. They say that aerosol is not actually causing the transmission of viral disease, but still, as Dr. Mohini said, the virus lies in a latent state because after the disease, the viral load shedding takes place. So we have to be careful at that time not to use ultrasonic, which might produce aerosol. So better to use the hand instrument. Regarding the WHO probe, which Jalaluddin sir asked, the ball tip which is present is about 0.5 millimeter diameter, which is present there. And unlike the other probes, the ball tip has been placed there so that when the probing is taking place, we know that the pocket is having a lot of micro ulcerations present. So when you put a probe inside the pocket, which is maybe, though the other periodontal probes are also blunt, but this ball tip would prevent the micro ulcerations from getting lacerated by the probe tip and causing bleeding. So this is one of the reason why the ball tip has been provided. Dr. Mohini said about the probing force. It is roughly about 25 newtons, which is being applied to do the probing force. If you want to really find out how much is that 25 Newton force which has to be applied, because if you apply more force into the pocket, you will definitely tear the junctional epithelium. So if you want to clinically find out how much probe you should apply, you should take the probe, periodontal probe, put it at your nail bed and press. The moment you start feeling the discomfort, that is the amount of pressure you should apply to probe the pocket. That is the exact amount of force you should apply. So since there is a lot of difference between person to person in probing force, and the newer probes came up, which is the pressure sensitive probes came into the market, which when you apply into the pocket and you put the probe to do the probing, the probe makes a click sound, which makes you aware that this is the exact amount of force that is to be used. You should not press more than that, the probe into the sulcus. Sir asked about UNC 15 probe. I think Dr. Ayon was discussing about the various probes. as discussed, University of North Carolina 15. That 15 basically is describing the markings on the probe. There is a marking up to 15 millimeter on the probe with black bands which are present at 3 places between 4 and 5, between 9 and 10, and between 14 and 15, which tells you the exact distance the pocket would be when you do the probing. And then Anupam sir asked about Crane Kaplan pocket marker. I think one of the girls, when they presented the surgical instruments, they mentioned about the gingivectomy. So a pocket marker is a very important instrument when you are going to do the gingivectomy procedure. Unless and until you mark the pocket, you cannot do the external bevel gingivectomy procedure. It is a very important instrument which will tell you the exact area till where the gingivectomy procedure has to be done. So these things you should all remember. These are basic things: instruments, Gracie curettes, universal curettes, scalers. All these things are very important because we all know the surgeon's best assets are his instruments. So if a dental surgeon does not know about his own instruments which are present with him for working, it will become very difficult. You will not be able to tell even your and the person who is working in your clinic, your subordinate, which instrument you want. So it becomes very important. So please take care of these things. You are all budding dentists. You should definitely know these things. And once you know, and once you know to use these instruments, definitely your practice will be more enjoyable. Thank you very much. Thank you, Dr. Anupam. Thank you, Dr. Jalaluddin. Thank you, Dr. Mohini. It was wonderful discussing and listening to you all.
Yeah, thank you. Thank you so much. I'd just like to take 1 minute. Thank you, Dr. Balaji Manohar, for adding so much of knowledge to us. It was like giving a cherry on the cake, really. And thank you, Dr. Anupam Podder, sir, for giving me the opportunity to stand here beside this all the eminent speakers. And good luck to all the participants. Thank you, everyone. Yeah. Take care.
Thank you, Dr. Mohini, and for coming with us. And I will give chance in next time for any session for you, any session in aesthetic dentistry.
Yeah, surely, sir. Yeah. Thank you. Thank you so much.
Hello?
Yes, sir. Are we winding up, sir?
Yeah.
Okay. Right. Thank you again. Nice meeting you all.
Thank
you, Balaji.
Thank you.
Hi, Dr. Jalaluddin. Thank you, sir.
Thank you, sir. Thank you.
Thank you, sir.
Thank you, sir. Balaji
Bye, sir.
Manohar.
Namaste.
Thank you. Namaste.
Namaste, sir. Namaste.
Sir. So good night, everyone.
Good night. Good night.
Dr. Balaji Manohar, sir,
Thank you.
Thank you to our respected judges, and thank you to participants for presenting very beautifully. And I would like to invite to the next paper presentation competition on 31 August of 2018, 10 p.m. on Axis Dental School page live. And the group will be Naveed, and the topic will be periodontal pocket. So I hope that that will be a very exciting live for all of you. And I invite everyone to join that live on 31 August, 10 p.m. on Axis Dental School live. So without any further delay, I would like to take permission of our honorable judges and our mentors and doctors so that I can end the live.
Thank you.
Yes, you can end the live. Thank you for your nice moderation. Thank you, Dr. Balaji Manohar, for your exciting presence. I hope you will be with us next time also. And
I will try, sir. I will try.
Okay. Our goal is to know the instrument, to know the instrument of the student.
Definitely.
Because earlier they do not know the name of the instrument.
Very true. Very
true. If they know the name of the instrument, we are successful for our. Thank you.
Okay. Thank you, sir. Thank you. Good night. I'm